Come in.
Hi, Miss Barnes.
Yes.
How are you today?
No, I've been better.
Oh, I'm sorry. I'm student physician Elizabeth Stoll. It's very nice to meet you. Do you have a preference on how you're referred to, Miss
Melinda is fine.
Melinda's okay? All right. Well, Melinda, what brings you in today?
I have a sore shoulder.
And you looked right down at that right one,
Mhm.
right shoulder. Okay. Well, I'm just going to let you know kind of how this is going to go today, just as a brief introduction. We'll definitely sit down and talk about this right shoulder, what's going on, do both a physical exam and osteopathic exam, and then I'll step out and talk to the attending, and we'll put our heads together and see what we can do to help the shoulder. Okay? Stop me at any point if you have questions, or this is a safe place for you, so please let me know if there's anything.
All right.
So this right shoulder, when did this start bothering you?
2 days ago.
Okay, were you doing anything specific?
I lifted a 5-gallon bucket of feed.
Okay. And can you describe what you felt?
Sharp.
Okay. And has that pain changed at all?
Well, when I don't move my shoulder, it's a dull ache.
Okay. But when you do, does that?
It's constant.
Okay. Wow, is this the first time this has happened?
Yeah, pretty much. I have had sore shoulders before, but nothing like this.
Okay. So no distinct injuries to that right shoulder. Okay. And if you said it's kind of a dull ache to sharp pain. So if you had to put a 1 to 10 scale to it, what is it when it's dull and what is it when it's sharp?
Well, right now it's about a 5 out of 10.
Okay.
And then when I move it, it's an 8 out of 10.
Wow. It's pretty high.
Mm-hmm.
Okay. Any specific movement that really bothers you? Any. All right. Anything that you've noticed makes it feel better?
Well, I tried icing and I've taken ibuprofen. And of course, not moving it makes it feel better.
Okay. Has ibuprofen helped?
A little bit.
Okay. How it works, other than movement, anything you can think of?
No.
Okay. That's it. How is it affecting your day?
Well, I have to use my left arm at work, so that's kind of easy. Yeah, difficult, not easy.
Yeah, I can imagine.
Not easy.
I'm just going to ask you some general questions about your past medical history, just so we get all the information. Any chronic medical conditions? Okay. How about childhood?
I had chicken pox,
Okay.
and yeah, that's the only.
Are you on any medication right now? Any prescription medication?
No.
Okay. And then, other than the ibuprofen, anything over the counter?
No.
Okay. And what do you know? How often you've been taking ibuprofen the last few days?
Every 4 or 5 hours.
Okay. And do you know your dose?
Yes, 3 pills. It's, I think, 600 milligrams.
Alrighty. And what about these supplements?
I take a multivitamin every day.
Great. Alright. Any allergies to any medications?
Penicillin.
Okay. What is your reaction?
A rash.
Just a little bit about your social history. What do you do for work?
I'm a house painter.
Oh, well, shoot. This is not helping.
Yeah.
How long have you been doing that?
Oh, 30 years.
Something you enjoy?
Yeah.
I'm just going to ask you kind of some general questions now, just to get a little deeper. Have you noticed any weight changes?
No.
Fever?
No.
Good. Chills? All right, well, let's get started and just do some testing, see what's going on with that shoulder. I'm just going to wash my hands real quick so there's no redness. I'm going to place my hand on top of your head, if that's okay with you, and just feel your spine. Maybe let me know if there's any tenderness with that. All right, well, let's just do some general range of motion, and we're going to start up in your neck. So I'm going to have you just go ahead and take your chin to your chest. Okay, and go as far back as you can. Great. Let's take one ear to your one shoulder and to the other. And then let's do nose to the wall. Okay. Let's do some strength testing. So I'm going to put you like this. Go ahead and push out for me. Okay, and go ahead and push in. Okay, so this is much stronger as well. All right. Perfect. All right, so let's just review everything real quick, make sure we have all the information. This happened when you're picking up a bucket. Dull paint, if you don't move it, but gets pretty sharp. Sounds like ice. Does help a little bit ibuprofen, but really no movement's all that's been helping so far. All right, well, I'm going to go talk to Dr. Sasio about everything I found with your shoulder. Like I said, we'll put our heads together and just try to get the best diagnosis possible for you and let you know what we can do moving forward.
Okay, great.
Questions for me before I leave?
No.
Okay. It'll be, I would say, maybe 10 minutes at the max.
Okay.
All right. Well, very nice to meet you. I'll see you in a few moments. Definitely.